Hello students, today I'll discuss role of spotters in learning pharmacology. Some examples given are: name an antibacterial drug that acts by inhibiting protein synthesis as shown below. In this pictorial, there is messenger RNA on which ribosomal units are there and which are involved in protein synthesis by incorporating amino acids at the predetermined sites. Now, looking to the pictorial, it appears that there is involvement of amino acids serially, and there is some drug that blocks more than. Aminoglycosides act on 30S ribosomal subunits which are involved in protein synthesis, and the three steps where they are acting is blockade of initiation complex at 5' end, misreading of messenger RNA leading to incorporation of wrong amino acid, and blocking translocation of amino acid chain or breakup of polysomes into non-functional monosomes that halts movement of ribosome on messenger RNA, and in this way aminoglycosides inhibit protein synthesis in the bacteria. Therefore, answer can be streptomycin, gentamicin, amikacin, or any other amino. Spot 2 is a 70 years diabetic male developed vesicular lesions with pain which involved T6 dermatome on left side of the chest. Looking to the lesions, they appear to be confluent vesicles, and enlarged view is also given. Now the question is, name a drug effective in this condition and when should it be started? Clinically relevant questions. The diagnosis from the pictorial is simple, and that is herpes zoster, also known as shingles. And antiviral drugs are given but must be given early, within 72 hours of onset of eruptions, and they can be continued for 5 to 7 or even up to 10 days. Acyclovir, valacyclovir or fanciclovir can be given. There are pharmacokinetic advantages for famciclovir or valacyclovir because acyclovir has to be given 5 times daily. Local treatment is also required, maybe calamine lotion or aluminum acetate soaks that reduce pain, soothing and cleansing action. Spot 3 is the identification of a drug A and B depending on their pharmacological profile. When given orally, drug A reduces blood pressure and cardiac output, causes bradycardia. It is useful in chronic stable angina pectoris, and long-term use after myocardial infarction reduces mortality. However, it may increase airway resistance and may not be very effective in variant angina, and usual adverse effects are tiredness and reduction in exercise capacity. Looking at this, it appears to be perhaps to be anti-adrenergic drug or a beta blocker. Now, drug B, when given orally, reduces blood pressure without affecting much cardiac output but causes bradycardia. It is useful in chronic stable angina pectoris and also in variant angina pectoris, and may reduce airway resistance. So it doesn't cause asthmatic attacks as compared to drug A. Long-term use post-MI does not reduce mortality, and the common ADRs are constipation and SAV nodal bradyarrhythmias. So looking on these two profiles, A appears to be a beta blocker, perhaps propranolol, and B appears to be calcium channel blocker which doesn't cause tachycardia. So it is non-dihydropyridine derivative, mostly verapamil or. Spot 4 is based on a pictorial. What is the effect of drug X on the cardiac action potential? If you look at the point X, there is prolongation of effective refractory period. Name an antiarrhythmic drug that acts by this mechanism. There are many drugs actually. Which beta adrenergic blocker shows this effect? And what changes do we expect on ECG when a patient is taking such drug? Now, the cardiac action potential is there where there is prolongation of the effective refractory period without changing the rate of rise of action potential, which is characteristic of class 1 drug like quinidine, but it is not there. These changes are caused by class 3 antiarrhythmics, which are amiodarone, dronedarone, and doptelet. It should be remembered that class 1A, disopyramide, procainamide, and quinidine have class 3 actions, but they also have class 1 action, that is change in the rate of rise of potential. Sotalol is a beta blocker and only beta blocker that has class 3 action. Prolongation of QT interval or QTc interval, corrected QT interval, is usually seen with the use of such drugs which prolong effective refractory period. And QT prolongation is one of the biggest risk factor for occurrence of ventricular torsion dysrhythmias, which can be lethal. Spot 5 is identification of the cutaneous lesions, cause of the lesion, and suggesting a treatment or a drug. Now, culture of the pus from this skin lesion revealed clusters of cocci as shown in the figure. Now, this cluster of cocci will be termed as staphylococci. So, it is a staphylococcus infection and it is called as impetigo. And the anti-staphylococcal penicillin or any other anti-staphylococcal drug can be given. Usually, for a smaller lesion, 2% mupirocin cream is given, applied twice daily for 5 days. Oral cephalexin 250 mg 4 times a day if disease is widespread, and if there is methicillin resistant staphylococcal aureus, then doxycycline 100 mg BD or clotrimazole double strength tablet to be given twice daily for 5 days. Spot 6 is the name the drug X that inhibits dihydrofolate reductase in bacteria. There is also a drug that inhibits dihydrofolate reductase in protozoa, particularly Plasmodia and Toxoplasma. And there is also a drug that also inhibits dihydrofolate reductase enzyme in human rapidly dividing cells. All have different therapeutic uses. And these drugs are: trimethoprim is most active against bacterial dihydrofolate reductase. Pyrimethamine and of course proguanil for Plasmodia are very active against Plasmodial dihydrofolate reductase as compared to bacteria or human dihydrofolate reductase enzyme. Now, high-dose pyrimethamine is used for the treatment of Toxoplasma infection in patients with HIV infection. The third drug, which inhibits human rapidly dividing dihydrofolate reductase enzyme, methotrexate, which is commonly used as immunosuppressant in anti-neoplastic agents. It inhibits dihydrofolate reductase, which is needed for regeneration of tetrahydrofolate for RNA-DNA synthesis in rapidly dividing cells. It also inhibits proliferation of inflammatory and immune cells in rheumatoid arthritis and in ulcerative colitis. Spot 7 is identify drug X and drug Y. This is thyroid hormonogenesis, and organification of the iodides occurs and is inhibited by drugs. Now, question asked is, name one drug each X and Y that acts on step X and Y as shown in the image, and which other drug acts at step 2, that is step Y. Now these two are very, the answer is organification of iodides by oxidation occurs in thyroglobulin, which is colloidal, and this results in formation of MIT and DIT, which are the precursors for thyroid hormonogenesis. T3, T4 are formed from MIT and DIT combinations. All thionamides, methimazole, carbimazole, and also propyl uracil, they act by inhibiting organification. Propyl thiouracil, in addition, inhibits deiodinase enzyme, so reduces peripheral conversion of T4 to T2. T3. Answer 2 is beta blocker propranolol, which is used in the treatment of thyrotoxicosis, also known to inhibit 5-deiodinase enzyme that is involved in conversion of T4 into T3. So it reduces formation of T3 or triiodothyronine. Amiodarone is another drug which causes inhibition of the conversion of T4 to T3. Spotter 8. What are the two hormonal drugs which are used in oral contraceptive pills such as Mala D or Mala N? And what are 7 brown tablets and why are these included? The answer is 21 white tablets have two hormones, estrogen ethinyl estradiol 30 microgram and progesterone levonorgestrel 150 microgram. And the 7 tablets are ferrous fumarate or ferrous sulfate 60 milligram. They are included to maintain continuous intake and treat existing anemia. Because there is no discontinuation in between, so there is therapeutic adherence. Spot 9 is name drug X that inhibits formation of acetaldehyde and mention its use. Also name one drug that inhibits metabolism of acetaldehyde and mention its use. Any anti-infective agent that exhibits such action is shown by drug Y. Now there are two drugs which will inhibit steps. Is a fomepizole, which is alcohol dehydrogenase inhibitor and is used in the treatment of methyl alcohol poisoning and ethylene glycol poisoning. Disulfiram is the second drug, that is a Y drug, that is aldehyde dehydrogenase inhibitor and is used in the treatment of chronic alcoholism to induce aversion to alcohol intake, because aldehyde levels are increased and person cannot tolerate the adverse effects of excessive aldehyde syndrome, and that is facial flushing, tachycardia, throbbing headache, nausea, vomiting, and of course in excess there will be hypotension. Metronidazole and third generation cephalosporin, cefoperazone and moxolactam also have antabuse-like or disulfiram-like effects. It should be remembered that the older anti-diabetic drug sulfonylureas also had this effect, but they are less often used. Spot 10 is on the prostaglandin synthesis, and there are two enzymes involved for two pathways, cyclooxygenase 1 and 2 for prostaglandin analogs and lipooxygenase pathway for formation of leukotrienes. Now the question on this: name one drug that reversibly inhibits COX-1 and COX-2 enzymes. Another question is name one drug that irreversibly inhibits COX-1 enzyme. Another could be name one lipooxygenase inhibitor and mention its use. Name one drug that inhibits platelet thromboxane 8-2 generation by inhibiting platelet COX-1. And name one drug that inhibits cysteine leukotriene receptors, that is cysteine LTR1. Now the answer to these are: ibuprofen is a reversible inhibitor, as are other NCRs, but aspirin is irreversible inhibitor. Xylitol is lipooxygenase inhibitor and it has been tried in chronic bronchial asthma. Low dose aspirin preferentially inhibits platelet cyclooxygenase, so there is a reduction in the formation of thromboxane A2, which is a strong aggregant agent. Montelukast and Zafarlukast are used in mild to moderate bronchial asthma because they are leukotriene receptor antagonists. So this is all about the spotters and how do we learn pharmacology by them. Traditionally, they have been used for assessment of large number of the students during university and internal examinations, but it can also be used as a learning tool individually or severally. However, it assesses knowledge domain at nose and knows how level actually. And construction of suitable items, that is spotters, is a labor intensive, requires a lot of the hard work. But it is very useful for understanding pharmacology and revising pharmacology. Thank you very much.